All right, so today we're going to be diving deep, really deep, into the world of epilepsy and genetics.
Okay.
Specifically, we're going to be looking at this thing called, have you heard of this?
Yes.
Polygenic risk scores,
Yes, polygenic risk
or
scores.
PRS for short. And, you might be wondering, like, okay, what is this? What's a polygenic risk score?
Yeah, why should I care?
Exactly. Why should I care? So think of it this way, like, our genes, they kind of give us like a nudge, in a certain direction, but they don't write our whole life story.
Right. Predisposition, not predetermination.
Exactly, yeah. You requested this deep dive, and I'm guessing maybe you have epilepsy in your family. Maybe you're just really fascinated by this whole like genetics and health connection.
It's a hot topic.
It is a hot topic.
Yeah.
And, I was reading through the research for this, and we've got, some papers that are like super focused on epilepsy and some that are looking at this PRS thing from like a broader kind of big picture perspective.
Yeah, it's like having, those cameras where you have a zoom lens?
Yeah.
And then you have a wide angle lens.
I like that, yeah.
And we're looking at this fascinating subject from both perspectives.
Ooh, I like that analogy. It's good. Okay, so one thing that like really jumped out at me was how like PRS seems to play like different roles in different types of epilepsy.
Right?
Like I was reading that higher PRS scores, they're linked to a greater chance of having what's called like familial epilepsy.
Yeah.
So like cases where epilepsy runs in the family.
Mm-hmm.
But it's not just like, oh, there's epilepsy in your family, you're going to get it. It's like these common genetic variations we're talking about.
Right.
They can actually like add to the risk.
Add to the risk, yeah.
Even when like there might be, a rare gene mutation already at play.
So you might have, what we would say is a monogenic form of epilepsy, where it's like one gene is the culprit that's causing this, but then on top of that, you have all these other common variations that everybody has.
Right.
That are increasing your risk even more.
So it's like, it's complex.
It's complicated.
Yeah.
It's not simple. And that's what's so fascinating about it.
Yeah, and what I thought was really interesting, too, is like, within familial epilepsy,
Yeah.
the connection between PRS and certain subtypes is like particularly strong.
Right.
So for example, there's a like solid link between PRS and what's called genetic generalized epilepsy, or GGE, where, correct me if I'm wrong, but this is where seizures like originate from both sides of the brain.
That's exactly right.
Okay.
So think about it as a generalized onset of the seizure as opposed to
Yeah.
a focal onset.
Right.
Which is where it starts in one particular area.
Yeah, and the link with focal epilepsy, where it starts in a specific area,
Yeah.
seems to be like weaker.
It's less clear.
Less clear, okay.
So it's like we're still figuring all of this out.
So this is making me think, like, if PRS can influence, like, the likelihood of developing epilepsy, could it also affect, like, how severe it is, how the condition becomes?
You're thinking like a scientist. That is exactly one of the questions that researchers are trying to answer.
Okay.
They've done studies that have actually shown that even within families where, like, we know this particular gene is causing epilepsy,
Yeah.
the family member with a higher PRS
Okay.
often has more severe epilepsy.
Wow, that's so interesting.
Isn't that fascinating? That
Yeah.
it's not just, do you have it or do you not have it?
Right.
It's also, well, if you do have it,
How bad is it?
how bad is it going to be?
Yeah, that's a really good point. So it's not just yes or no. It's like
It's a spectrum.
it's a spectrum. Okay.
Yeah.
And there's this one study, I think it was in one of the papers we were looking at, that focused on the GBRG2 gene,
Right.
which is linked to a type of epilepsy called GEFS plus MAY.
Yeah.
And in families with a specific mutation in this gene, those with a higher PRS score for epilepsy actually had like more severe symptoms,
Right.
which is like, that's a pretty powerful illustration of how like intertwined this all is.
It is. It's like, we think about genes and we think about disease and we think, oh, this gene causes this disease.
Yeah.
It's not that simple.
No.
It's way more complicated than that.
Way more nuanced.
Yeah.
Yeah. And it seems like, PRS isn't just about epilepsy either, right?
Right.
I was reading that researchers are finding all these like fascinating correlations
Yes.
between PRS scores and like other aspects of brain function,
Right?
even like personality.
Yeah, so this is where it gets really interesting. And this is, I think, why people get really interested in it.
Yeah.
Because, for example, they found that individuals with a higher PRS for GGE
Right.
were more likely to report lower educational attainment
Interesting.
and also to experience mood swings.
Wow. Okay.
So it's suggesting that these genetic influences, they don't just stop at seizures.
Right.
They might actually be impacting other areas of brain function, behavior, even personality.
That's pretty mind-blowing, to be honest.
Yeah.
But I imagine there are lots of factors at play here, right? It can't just be.
Absolutely. This is where we have to be really careful.
Yeah.
And remember that, correlation does not equal causation.
Right. That's important.
So just because we see these correlations
Yeah.
doesn't mean that, having this genetic predisposition is causing these things.
Right.
There are environmental influences, there are lifestyle choices, there are complex interactions between genes,
So many things.
all contributing to the big picture.
Right. It's like a puzzle
It's a very intricate puzzle.
with lots of pieces.
Yeah, and PRS is just one piece.
One piece of the puzzle. Okay. And that brings us to, I don't want to say elephant in the room, but, like every tool has its limitations.
Right.
Right. And PRS is no exception.
For sure. For sure.
What are some of the, challenges
Yeah.
that that researchers are kind of grappling with when it comes to, how accurate it is?
Well, one of the biggest challenges right now, and this is true for a lot of things in genetics, is that the accuracy of PRS
Okay.
can vary greatly depending on a person's ancestry.
Okay.
So currently, PRS is most accurate for individuals of European descent.
Okay.
And this is because of biases in the genetic data
I see.
that is used to develop these scores, which, is a direct result of who's been historically included
Mm-hmm.
and excluded from genetic research.
So if you're not of European descent,
Yeah.
the PRS, might not be
It might not be as reliable.
as reliable. Okay. And
Yep.
that's definitely concerning.
Yeah, and I think a lot of people in genetics are aware of this
Mm-hmm.
and are really pushing for
More inclusive research.
more inclusive research.
Yeah. Okay. So that's one issue.
There's one issue. And then, I think we also have to remember that PRS is based on common genetic variations,
Okay.
but rare variations
Right.
can also play a role in epilepsy. And we're still figuring out how environmental factors play into this.
It's complex.
It's complex.
So it sounds like while PRS has incredible potential, we need to proceed with
Caution.
caution.
Yes, responsibly.
Responsibly. Okay. So let's end this part of our deep dive on a hopeful note.
Yeah.
What's on the horizon for PRS and epilepsy? What future possibilities are researchers really excited about?
I think a lot of people are really excited about the possibility of actually using this
Oh.
in clinical settings.
In real life.
In real life, yeah. Imagine a future
Yeah.
where we can use PRS to, identify individuals
Okay.
who are at a higher risk of developing epilepsy,
Okay.
potentially even before they have their first seizure. So before anything even happens,
Whoa.
we're identifying people who might be at risk.
That would be incredible.
Right.
Because right now it can be such a long road to actually get a diagnosis.
Right, it is.
You have to kind of, wait and see. Are these actually seizures?
Yeah, a lot of it depends on observation. Yeah.
And interpreting seizure symptoms. And there are other things that can mimic seizures.
Oh, really?
Oh, yeah.
I didn't know that.
Yeah. So it can be really difficult
To know for sure.
to know for sure.
And in the meantime, you're just
In limbo.
in limbo, yeah.
Wondering what's going on.
Stressed.
Not knowing.
Not knowing.
Yeah. So if PRS could flag those who are at a higher risk,
Yeah.
that would be a game changer.
Early identification, potentially early intervention,
Early intervention.
maybe even preventing
Whoa.
the development of epilepsy in some cases.
That's amazing.
Right.
Preventative care, but taken to a whole new
A
level.
whole new level. But of course, with any new tool, there are hurdles
Yeah.
that we have to overcome
Right.
before this becomes routine.
Part of just regular epilepsy care.
Regular epilepsy care, yeah.
Okay.
And we've talked about some of them already, like the accuracy issues
Yep.
with different ancestry groups. But there's another layer to this too.
Okay. I'm curious, what else? What else is there to consider?
Well, I think one of the big challenges is figuring out how to communicate
Okay.
this complex genetic information to patients
Mm-hmm.
in a way that's both understandable
Why?
and empowering.
Okay.
We don't want to just, give people data
Right.
and say, here you go, figure it out.
Yeah, it's
We
overwhelming.
need to make sure that healthcare providers are equipped
Yeah.
to interpret these scores,
So explain it.
to explain it, yeah,
Yeah.
and to really, counsel patients,
Mhm.
help them understand what it means for them.
Right. Because it's such a delicate balance, right?
Yes.
Because you don't want to cause unnecessary anxiety.
Right.
But you also don't want to, like, give people a false sense of security.
Exactly.
Like, oh, my score is good. I'm fine.
Right, right. It's about really helping people understand what PRS is, what it means, and importantly, what it doesn't mean.
Right.
It's not a crystal ball.
It's not a guarantee.
It's not a guarantee, yeah.
Okay.
It's a piece of the puzzle,
Right.
but it's not the whole puzzle.
Yeah, so this makes me think about, like, education.
Yes.
Like, for both doctors
Yes.
and patients.
Absolutely, yeah. I think there needs to be a lot more investment and resources
Yeah.
in helping people understand and navigate this new landscape.
This whole world of genetic information.
Yes.
Wow. Okay, but beyond just, like, the practical considerations,
Yeah.
there's also, like, the ethical.
Right.
Right? It's like,
Exactly.
this is what I think is so interesting, is it's not just about the science.
Right.
It's about, like, the human impact.
The human side of it.
Yeah, for sure.
You know, as we go further down this road of personalized medicine,
Mm-hmm.
we have to be very careful
Yeah.
about how we use this information
Right.
to guide healthcure decisions.
It's a big responsibility.
It is, yeah.
But even with all these challenges, I'm excited to see how this research unfolds.
Me too, me too.
I'm curious, like, are there specific areas within, like, epilepsy care where you think PRS could make, like, the biggest impact?
You know, I think one area where it holds a lot of promise is in predicting someone's risk
Okay.
of developing epilepsy
Mm-hmm.
after they've had their first seizure.
Okay.
So right now, you know, someone has their first seizure.
Yeah.
It's kind of a waiting game.
Right.
We don't always know if they're going to have another one,
Mm-hmm.
if this was a one-time thing.
Right. Or is this the beginning?
Or is this the beginning of epilepsy? And that uncertainty can be really difficult for patients and their families.
Oh, for sure.
So how could PRS change that?
Yeah. How could it?
Well, studies have shown that individuals with a higher epilepsy PRS
Okay.
are more likely to have more seizures
Yeah.
and to eventually be diagnosed with epilepsy.
So you could use it to, like, kind of?
You could use it to stratify patients. Stratify, okay.
After a first seizure.
Mhm.
So identify those who are at higher risk.
Gotcha. Okay, so you'd be able to kind of like figure out who's at higher risk like sooner,
Yeah.
but then like what does that mean practically?
That's where it gets really interesting, I think. Because
Yeah.
now you can start thinking about,
Yeah,
okay, we have this information.
yeah,
How do we use it to guide clinical decisions?
right, exactly.
So, for example, for patients with a higher PRS
Okay.
and therefore a higher risk of future seizures,
Mhm.
starting anti-seizure medications earlier might be the best course of action.
Okay,
Right.
that makes sense.
Early intervention.
Early intervention, yeah.
Potentially reduce the likelihood of them having more seizures,
Yeah.
reduce all the negative impact that can have
Right,
on their lives.
right, because seizures are not just like a seizure. It's like they affect your whole life.
Absolutely.
Your work, your driving, everything.
Everything.
Okay, so that makes sense. On the other hand,
Yeah.
for individuals with a lower PRS
Okay.
and therefore a lower risk,
Yeah.
a watch and wait approach might be more appropriate.
Okay, so it's really about, like,
Yeah.
personalizing it.
It's about personalization, yeah.
Yeah.
Using this information to personalize the treatment plan.
So it's not just like a one-size-fits-all approach.
Exactly, exactly. We're moving away from that.
I like that.
Uh-huh.
Okay, are there any other, like, ways that you think PRS could be used in epilepsy care?
You know, there's been some interesting research on using PRS
Okay.
to distinguish between
Okay.
different types of epilepsy.
Okay.
Particularly, you know, we were talking about genetic generalized epilepsy and focal epilepsy.
Right, and just to, like, remind everybody.
Yeah.
Genetic generalized epilepsy is where it starts on both sides of the brain at the same time.
Both sides of the brain, yeah.
Focal is where it's, like, a specific spot.
One specific area.
Okay. So where does PRS, like, fit in with all this?
Well, studies have shown that people with a high PRS
Okay.
for genetic generalized epilepsy
Yeah.
are more likely to be diagnosed with, you guessed it,
Genetic generalized epilepsy.
genetic generalized epilepsy.
Okay, that makes sense.
Yeah, it makes sense.
What about focal?
Focal is a little more complicated.
Okay.
Some studies have found a link,
Okay.
but it's not as strong or consistent
Check.
as the one with genetic generalized epilepsy.
Okay, so even though it might not be a perfect predictor
Right.
for focal epilepsy,
Yeah.
it could still be, like, a useful tool
Oh, absolutely.
to help doctors kind of like.
Yeah, narrow down the possibility.
Narrow it down.
Especially when combined with other clinical information.
Right. It's like, it's all about adding, like.
Yeah, it's adding another layer of information.
Another piece to the puzzle.
Another piece to the puzzle.
Yeah, and I'm kind of seeing a theme here that it's like PRS is all about like adding a piece to the puzzle.
Right.
Helping doctors make like more informed
decisions, yeah.
Yeah, more personalized decisions.
More personalized decisions.
Okay.
It's not meant to replace like the traditional methods.
Right.
But to make them even better.
To make them better.
Yeah. And as this technology improves and becomes more accessible,
yeah,
I think we'll see its impact grow even more.
I'm really curious about that. Like, how else might it like change how we approach epilepsy care in the future?
Well, remember that study we were talking about earlier, the one about the link between higher PRS and more severe symptoms?
With the GBRG2 gene.
Right, in individuals with that specific GBRG2 gene mutation.
Right.
That was a really great illustration, I think, of how, common variations can kind of work together with those known genetic causes to affect how the disease presents itself.
Yeah, it was a good example of how it's not simple.
It's not simple.
It's really complex.
It's complex. Well, that same idea applies to epilepsy in a broader sense.
Okay, so like bigger picture.
Bigger picture, yeah. So research suggests that individuals with a higher overall PRS for epilepsy tend to experience more frequent seizures, have a higher likelihood of drug-resistant epilepsy.
Oh, wow.
And might be at greater risk of developing complications related to epilepsy.
So it's like it could act as like
a warning system.
A warning system. Like, hey, pay attention.
Pay attention to this person. They might need more aggressive treatment. Right from the start, or closer monitoring.
Gotcha. So it's about like tailoring the management plan.
Tailoring it
to each individual.
Each individual, yeah.
Okay. I like that.
And hopefully improve long-term outcomes.
Yeah. Because ultimately that's what we want, right?
That's what we want, yeah.
It's for people to live their best lives.
Absolutely.
Okay. So we've been so focused on like the clinical side of things.
Right.
But I think it's important to remember that like PRS is also a powerful research tool.
Absolutely, yeah.
Like it's about more than just like, predicting individual risk.
Right.
Or guiding treatment decisions.
It's about understanding the fundamental biology.
It's about understanding like the why.
The why.
Like what's going on here?
What's happening in the brain?
Yeah. Why is this happening?
Why is this happening?
It's like we're looking at it through a whole new lens.
A new lens, yeah.
So like, what are some of the key insights that like PRS research has uncovered so far?
Well, I think one of the most surprising findings has been the correlation between PRS scores for epilepsy and PRS scores for other neurodevelopmental and psychiatric conditions.
Like what?
Like ADHD, autism spectrum disorder, schizophrenia.
Wait, are you saying like the same like genetic variations that like make someone susceptible to epilepsy might also increase their risk for these other things?
That's what the research is suggesting.
Whoa.
Yeah, it's pointing to a shared genetic foundation for a whole range of brain-related disorders.
Wow.
So it really challenges the way we've traditionally thought about these conditions.
Yeah, like in these like little boxes.
Yeah, these little boxes, as separate and distinct diagnoses.
Right.
And it's saying, well, maybe not.
Maybe not.
Maybe there's a lot more overlap.
It's like we're realizing that the brain is just this like super complex network.
Right.
And that like these genetic risk factors can like manifest in all these different ways.
In different ways, yeah.
It's not just like you get this or you get that.
It's not that simple.
It's not that simple. Okay, so we're moving away from that like siloed view.
Siloed view, yeah.
Starting to see the bigger picture.
The bigger picture. And that has huge implications.
Yeah.
For research, diagnosis, treatment.
For everything.
For everything.
Okay, there's so much to unpack here.
Yes.
This is definitely something I need some time to process.
I think we all do.
Okay, I think it's time for another pause.
Yes.
Before we continue. Okay, I think I'm starting to get like the implications of these like shared genetic links.
Yeah.
That we were just talking about.
It's a lot.
It is a lot.
It really highlights just how interconnected brain function really is. You know, it's not about these isolated diagnoses anymore.
Right.
It's about recognizing that there's this whole spectrum of possibilities within brain health.
So how do we like take this knowledge and actually apply it? Like,
Right.
what are the practical implications for someone listening
Yeah.
who maybe, has epilepsy or even like other brain-related conditions?
Well, I think one of the biggest potential benefits is, earlier identification and intervention.
Okay.
So, for example, if a child is diagnosed with autism,
Okay.
knowing that they also have a higher PRS for epilepsy
Okay.
could mean that, doctors are more vigilant
Yeah.
about watching for any signs of seizures.
So it's like being proactive
Proact.
instead of waiting for something to happen.
Exactly. It's a shift in mindset from treating, these isolated conditions to thinking about
Yeah.
this broader spectrum of brain health
Okay.
and potential vulnerabilities.
That makes sense.
Yeah.
And this knowledge could also like have a big impact on research, right?
Oh, absolutely.
Yeah.
Understanding these shared genetic pathways could open up whole new avenues for developing treatments.
Oh, wow.
Imagine treatments that target the root causes
Yeah.
of these conditions rather than just managing the symptoms.
Right.
It's a whole new way of thinking about treatment.
It feels like we're on the verge of like a major breakthrough
It does.
in how we like understand and approach brain health.
Yeah.
Like so much of this is about connecting the dots and seeing the bigger picture.
Yeah, and that's what makes this research so exciting. It's not just about epilepsy in isolation.
Mm-hmm.
It's about understanding the brain as this complex and interconnected system.
So we've talked about how PRS can be used for risk prediction,
Yeah.
diagnosis, and even like predicting the severity of epilepsy.
Right.
But can it also help us determine the best course of treatment?
That's the million-dollar question.
Yeah.
A lot of researchers are trying to figure that out.
Like specifically, can it help us choose the right medications?
Exactly.
Okay.
The idea is that by understanding a person's genetic makeup,
Okay.
we might be able to predict how they'll respond to different anti-seizure medications.
Oh, wow.
So it's the idea of truly personalized medicine
Yeah.
tailored to the individual.
Because right now, finding the right medication is like, it's a lot of trial and error.
It's a lot of trial and error.
Yeah.
It can take a long time to find a medication that's effective
Yeah.
at controlling seizures without causing side effects that
Yeah.
are intolerable.
And in the meantime, people are still having seizures,
Still having seizures, yeah.
which affects their lives.
Absolutely.
So how could PRS change that?
Well, imagine a future where we can use genetic information to make more informed medication choices from the beginning.
Right from the start.
Right from the start.
Okay.
So increase the chances of finding an effective treatment sooner.
That would be amazing.
Right.
To be able to just like skip all that trial and error.
Skip the guesswork.
Yeah.
And give people a better chance of living a life free from seizures.
But is this like actually happening?
It's still early days.
Okay.
But there's been some really promising research.
Okay.
For instance, some studies have found specific genetic variations
Yeah.
that are associated with a higher risk of developing drug-resistant epilepsy.
So that's epilepsy that doesn't respond to medication.
Exactly. And for those individuals, doctors might consider other treatment approaches sooner,
Like what?
like surgery or specific dietary therapies,
Oh, okay.
things like that.
So even if it can't tell you the exact medication,
Right.
it can still tell you like,
It can give you information about the overall treatment strategy. It's another piece of the puzzle that helps guide those decisions.
I'm seeing a theme.
I know, right?
Okay.
It's all about adding information
Yeah.
to personalize those decisions.
Right.
And as research progresses, I think we'll see more and more examples
Yeah.
of how this can really change things.
Like I'm getting excited thinking about it.
Me too.
It's pretty cool. We're moving toward a future where like each person's treatment plan
Yeah.
is like tailored to their needs and their genes
It's really
to maximize their chances of like really living a full life.
a full and healthy life.
Okay.
Yeah.
But we've been so focused on the clinical side.
Right.
I think it's also important to remember that PRS is a powerful research tool too.
Absolutely.
It's
Yeah.
not just about like, predicting risk or guiding treatment.
Right.
It's about understanding epilepsy better.
Yeah, it's about deepening our understanding of the fundamental biology behind it.
Yeah, like we're looking at the disease through this brand new lens.
A new lens, yeah.
So what are some of the key insights that PRS research has like uncovered so far?
Well, one of the most surprising findings, I think, has been the correlation
Okay.
between PRS scores for epilepsy
Yeah.
and PRS scores for other neurodevelopmental and psychiatric conditions,
Like what? What kinds of conditions?
like ADHD, autism spectrum disorder, schizophrenia.
Wait, are you saying that the same genetic variations that make someone susceptible to epilepsy
Yeah.
might also increase their risk for those.
That's what the research is suggesting.
Oh.
Yeah, it's pointing to a shared genetic foundation
Okay.
for a whole range of brain-related disorders.
So, like, it's not just about epilepsy.
It's not just about epilepsy.
It's about, like, how all these things might be connected.
Exactly, and that challenges the way we've traditionally thought about these conditions as
Yeah.
separate diagnoses.
Right.
It's like, well, maybe not.
Maybe not.
Maybe there's a lot more overlap than we realize.
It's like we're realizing that the brain is this incredibly complex network, and these genetic risk factors can manifest in so many different ways.
Different ways. Yeah.
It's not just like, oh, you get this one thing or you get that one thing.
It's not that simple.
It's not that simple, okay?
Oh.
So we're moving away from that siloed view of these conditions and starting to see, like, the bigger picture.
The bigger picture. And that has huge implications.
Yeah.
For research, for diagnosis, for treatment.
For everything.
For everything.
Okay. There's so much to unpack here.
Yes.
This is definitely something I need some time to process.
I think we all do.
Okay. I think it's time for another pause
Yes.
before we continue. Okay. I think I'm, like, starting to grasp the implications of these shared genetic links
Yeah.
that we were talking about. It's a lot.
It's fascinating, but it's complex.
It is. It really is.
Yeah.
So, like, how do we, like, take this knowledge and actually use it?
Right.
What are the practical implications of these findings for, like, someone listening? You know,
Yeah.
maybe they have epilepsy. Maybe they have another, like, brain-related condition.
Well, one of the biggest potential benefits, I think, is earlier identification and intervention. So, for example, if a child is diagnosed with autism, knowing that they also have a higher PRS for epilepsy could mean that doctors are more vigilant about watching for any signs of seizures.
So it's about being, like, proactive.
Proactive.
Instead of reactive, like waiting till something happens.
Exactly. Yeah. It's a shift in mindset.
Okay.
From treating these isolated conditions to thinking about a broader spectrum of brain health and potential vulnerabilities.
That makes sense. And this knowledge could also have a big impact on research, right?
Oh, absolutely. Understanding these shared genetic pathways could open up whole new avenues for developing treatments. Imagine treatments that target the root causes of these conditions rather than just managing the symptoms.
Right. Get to the source.
To the source, yeah. It's a whole new way of thinking about treatment.
Yeah, it feels like we're, like, really on the verge of, like, a major breakthrough.
I think so, too.
In how we understand and approach brain health as a whole.
Absolutely.
Like, so much of this is about, like, connecting the dots, seeing that bigger picture.
Yeah, and that's what makes this research so exciting. It's not just about epilepsy in isolation anymore. It's about understanding the brain as a complex and interconnected system.
So we've talked about how PRS can be used for risk prediction, diagnosis, even, like, predicting how severe someone's epilepsy might be.
Yeah.
But I'm curious, can it also help us figure out the best way to treat it?
That's a great question.
Like, can it help us choose the right medications for epilepsy?
That's a question that a lot of researchers are trying to answer.
Okay.
The idea is that by understanding a person's genetic makeup, we might be able to predict how they'll respond to different anti-seizure medications.
Oh, wow.
It's the idea of truly personalized medicine, tailored to the individual.
That would be incredible. Because right now, like, finding the right medication, it can be such a long and frustrating process.
It is, yeah. A lot of trial and error.
Trial and error.
Yeah.
It can take a long time to find one that works and that doesn't have, like, awful side effects.
Exactly. And in the meantime, people are still having seizures.
Right, which, like, really affects their lives.
Absolutely.
So, like, how could PRS change that?
Well, imagine a future where we can use genetic information to make those medication choices more informed right from the beginning.
Oh, wow.
So you increase the chances of finding an effective treatment much sooner.
So you could, like, skip all that, like, trial and error period?
Potentially, yeah.
That'd be amazing.
Give people a better chance of living a life free from seizures.
But is this actually happening already?
It's still early days, but there has been some really promising research.
Okay.
For instance, some studies have found specific genetic variations that are associated with a higher risk of developing drug-resistant epilepsy.
So that's epilepsy that just doesn't respond to medication.
Exactly.
Wow.
And for those individuals, doctors might consider other treatment approaches sooner.
Okay, like what kinds of things?
Things like surgery or specific dietary therapies.
Oh, okay. So even if, like, PRS can't tell you this is the exact medication that will work,
Right.
it can still provide, like, valuable information
Yeah.
about the overall strategy.
Absolutely. It gives you more information to work with.
Yeah.
It's another piece of the puzzle to help guide those decisions.
Yeah, I'm seeing a theme here.
Right.
Okay.
It's all about adding information
Yeah.
to make those decisions more personalized.
Okay, I like that.
And as research in this area progresses, I think we'll see more and more examples
Yeah.
of how personalized medicine can really transform epilepsy care.
It's pretty exciting to think about the possibilities.
It is. It is.
It feels like we're moving toward a future where, like, each person's treatment plan is tailored to them.
Yeah.
Like, to their needs and their genetic makeup,
Absolutely.
to give them the best chance at, like, living a full and healthy life.
I agree. It's a very exciting time to be involved in this field.
We've covered so much in this deep dive.
I have.
From, like, just what is PRS, even
Wow.
to, like, its potential application in epilepsy care,
Yeah.
and even, like,
Yeah.
the bigger picture of brain health.
It's been quite a journey.
It has been a journey, and it's clear that this is just the beginning.
Oh, absolutely.
Like, PRS research is moving so fast,
More rapidly advancing.
and I'm excited to see what the future holds.
Me too.
But before we wrap things up, I want to leave our listener with a question to think about.
Okay.
Given everything we've learned today about PRS and epilepsy,
Yeah.
how do you think this knowledge will shape not just, like, how we approach diagnosis and treatment,
Mm-hmm.
but also how we understand brain health in a more holistic way?
That's a great question, and one that I think will spark a lot of important conversations in the years to come. This is something that researchers, doctors, and people living with epilepsy will continue to explore and debate.
And it's a conversation worth having. The more we learn about the connections between, our genes and our health,
Yeah,
the better equipped we'll be to create a world where everyone can thrive.
absolutely.
Thank you for joining us on this deep dive.
Yeah.
We'll be back soon with another fascinating exploration.